GP surgeries have been there throughout the pandemic, available for our patients, doing our best to look after people, despite the circumstances being quite difficult. Patients have learned to contact us in a variety of different ways, and GP surgeries have adapted rapidly to make sure there's a whole selection of different ways that our patients can get in touch with us. Quite a lot choose to contact us by telephone, and a lot of things can be really easily sorted in that way. But there are other ways to contact us as well, and a lot of GP surgeries are now using online forms. 97% of practices now have the ability to consult remotely. And there are also video consultations as well, where a patient needs to be seen but not examined physically. To keep patients safe and to keep staff safe, we will only see you where a physical examination is necessary. With everything else, we will try and sort things out without necessarily bringing you down to the GP surgery. We appreciate that it all feels a bit weird at the moment, and that we're all learning how to do this together. And we do know that some of the things that you would have experienced previously, you won't be able to experience in the current NHS, because some services are just not available. We also appreciate that sometimes it does take a little bit longer to sort things out with remote consulting. But we do know that some people have really appreciated it. Most surgeries now have the ability to zone their surgery, and then what that means is there will be particular areas where they will see shielded or cold patients, and there will either be a hub or a particular area of the surgery where they would see somebody who potentially has COVID, and it's really important that we do treat people in areas that are correct for their needs. Each room is cleaned between every patient if we do see people, and every surgery is cleaned on a regular basis to try and minimise the risk to patients. We appreciate that a lot of people are really worried about coming to GP surgeries and going to hospitals, and what we would like to do is to reassure people that standards of cleanliness have always been very high, and we are particularly vigilant on that at the moment. Things are different. We are working remotely. Sometimes the GP that you're talking to may not be in the surgery. They may be working remotely for a whole host of different reasons, but we are still there. We will do our best to help you. It just feels a bit different to the way that it used to feel.